All right. Good morning, everybody, and welcome to the Kidney Foundation of Ohio Learning Series webinar. We thank you all for being present. This is a webinar format, so you won't see your picture on the screen, and all of your microphones are muted. If you have any questions, we do have the question and answer box that you're able to utilize. All right. Just a little bit, for those of you who aren't familiar, Kidney Foundation of Ohio, we provide direct assistance to kidney patients um, throughout the northern and eastern parts of Ohio. We also have 2 affiliate chapters in Lake and Summit County. And our program and the idea of our program is to just support our patients. So the funds we raise stay here within Ohio to support our patients. Just a quick announcement that we have our 49th annual renal symposium that will be taking place Thursday and Friday, September 12th and 13th at Wagner's of Westlake. We'll be offering CEUs, presentations, just an opportunity to net with other professionals in the field. And we encourage you to keep a lookout. Registration will be opening next month. So you'll be getting stuff in your emails. And for all of you who've registered for this webinar, you are now on our mailing list. So you'll be getting information about upcoming events that are coming up with the Kidney Foundation of Ohio. We want to thank Nephew as one of our sponsors for today's webinar, along with University Hospital Transplant Institute. So we thank you all for being here today to learn about living kidney donation. The webinar will last about an hour. Again, questions and answers can be submitted via the question and answer box. This webinar is being recorded, so we will be sending a copy of the recording. The recording will not be offered for continuing education, but being present today, you will have the opportunity for CEUs. We have this webinar has been approved by both the Ohio League of Nursing and the Transplant Coordinator Certification. So at the end of today's presentation, you will be invited to do a survey. That survey will then generate certificates which will be sent to you in the next week. So at this time, I'd like to introduce Dr. Rima Kang, who is the Assistant Professor, Clinical Medicine Division of Nephrology at Ohio State University Wexner Medical Center, and Jill Green, PhD. She is the Medical Science Director and Field Medical Affairs at OTSCA, providing living kidney donor. So I'm going to turn the presentation over to Dr. Jill and Dr. Rima.
Right, thanks so much, Jennifer. And I'm going to apologize up front. I'll try and speak as loud as I can, but unfortunately, my voice is just barely hanging on. But we're happy that you all have joined us today to discuss living kidney donation, one solution for patients with end-stage kidney disease. Next slide. So full disclaimer, this program is paid for by OTSCA Pharmaceuticals. And Dr. Kang and I, she's a paid consultant and I'm an employee of Otsuka. Next slide. This is another full disclaimer regarding our disclosures. So Dr. Kang and I have indicated our relevant financial relationship with Otsuka Pharmaceuticals. I'm employed by Otsuka. Dr. Kang is a consultant, as mentioned before. As the OLN approved provider, we have maintained responsibility for determination of learning outcomes and content, selection of activity presenters, awarding contact hours, record keeping procedures, evaluation methods, and categories. and then management of the support. The board that approved, we also ensure that arrangements of commercial exhibits will not influence, which doesn't apply today because it's just a webinar. And then any products or services displayed within the presentation are not endorsed by the Kidney Foundation of Ohio. So just so we're all clear, this is a non-branded, we are not talking about any products. We're really just talking about how kidney disease progresses over time. What are the different options for patients that do reach kidney failure? We'll touch a little bit on dialysis, a little bit on transplant from a deceased donor, and then an emphasis on living kidney donation as an alternative options. Next slide, please. So a little bit about NephU, as many of you that have attended these webinars in the past know who NephU or Nephrology University is. This is the medical education platform at Otsuka Pharmaceuticals. We support various aspects of kidney disease and kidney health. So whether we're specifically talking about a particular disease, such as polycystic kidney disease, or if we're talking about different aspects of kidney health, so whether that's the mental health of kidney patients, whether that's tips and tricks on diet and lifestyle modifications that can help the outcomes and improve outcomes for these patients with kidney disease. So we offer various programming, whether that's in your office, outside of your office, virtually like we are doing today, on these various topics. Next slide. And this just kind of outlines kind of the breadth of various presentations that we can present to your group or association. Next slide. So today's webinar, as mentioned, it's on living kidney donation. By the end of the talk, we hope that you understand the stages of kidney disease and renal replacement therapy options, identify the various types of kidney transplantation, understanding the current landscape and outcomes based on the type of renal replacement therapy, and then identify challenges for living kidney donation and ways we're trying to combat those barriers and overcome them. As already mentioned, Dr. Rima Kang is a guest lecturer today, and she is an assistant professor of clinical medicine in the Division of Nephrology at The Ohio State University. I myself, I'm on the medical education side of Otsuka, and also a proud living kidney donor. So I'll touch on that at the very end of the presentation, kind of my personal testimony and journey through living kidney donation before or after all of the science part of it. Next slide. And then with that, I will hand it over to Dr. Kang.
All right, thank you so much for the introduction and for the segue into the bulk of the talk. We'll start off by discussing the different stages of chronic kidney disease. And so the definition listed here is, the presence of kidney damage for 3 or more months. But, the definition of CKD actually kind of encompasses much more than just, GFR. So this is any abnormality in kidney structure or function for greater than 3 months. So we know that even if individuals have normal GFR, they may have CKD because there may be something histologically that's going on that we don't pick up by GFR assessment. So, if you think about some of your younger patients with lupus nephritis who have normal GFR, for example. The presence of albuminuria should also be included in our definition of chronic kidney disease. And this means a urinary albumin creatinine ratio of 30 milligrams per gram or 30 milligrams in 24 hours. Any abnormalities on urine sediment or electrolyte issues due to tubular disorders, that all kind of falls under the definition for chronic kidney disease. But if we kind of break it down simply in terms of, percent of normal kidney function and the different stages, it's nice for us to sort of describe to our patients in terms of percent. That's an easy way to think about it, and that's broken down by stage here. And it kind of provides a good, understanding in terms of what's my kidney function and what does that mean for the future. But, again, stage 1 is GFR greater than or equal to 90. Stage 2 is 60 to 89. Stage 3 is 30 to 59. And of course, we subdivide stage 3 into 3A and 3B, where 3A is 45 to 59 and stage 3B is 30 to 44. And then as we get into the more advanced stages of chronic kidney disease, stage 4, 15 to 29 for the GFR, and then anything below 15 is stage 5, and approaching dialysis at that point. Next slide, please. Okay, so what are the choices for our patients once they have reached end-stage renal disease? So 3 options here: hemodialysis, which can be done in-center or at home; peritoneal dialysis, obviously a home modality; or transplant. So this is preemptive transplant as kind of their next option before dialysis. So deceased or living donor are options here. Interestingly, in-center hemodialysis remains the predominant modality as of right now. And research actually tends to suggest that most patients would choose a home modality if they had the time for more counseling and more education on the different modalities, as well as time for training. Preemptive transplant, unfortunately, still remains the far minority. And I think there are a lot of things that account for this, and likely we'll touch on this a little bit later in the talk when Jill discusses barriers to transplant. But there is some data, according to the USRDS, suggesting that the majority of ESRD patients don't have any nephrology care for over a year. So most of these patients have less than a year of chronic follow-up with a nephrologist. So I think that likely plays a role in not only home modalities, the lack of home modalities, but also preemptive transplant. Next slide, please. Okay, so now we'll touch on the different transplant choices that we have. In 2014, so we're now December 2014, so we're approaching about 10 years of the newer kidney allocation system, but essentially the goals were to provide higher quality organs to younger and healthier patients. They also tried to address more racial and ethnic minorities in terms of access to transplant, and increasing access to the transplant for the patients who are highly sensitized, right? So patients with a lot of antibodies who wouldn't otherwise be a candidate for transplant. Now we're trying to increase those opportunities for those patients as well. And they also included a component in terms of adding your time on renal replacement therapy as part of your waitlist time. So the most common solution we see here is deceased donation, right? So these are the patients who go on the deceased donor kidney transplant list. So essentially you have a deceased donor that goes to a kidney recipient who is on the list. And again, the goal here is to provide the best organ in terms of longevity for that particular patient. So we're looking at the longevity of the organ, but also the post-transplant survival of the patient. And there's actually 2 scoring systems that go into this. So we look at a KDPI score, and that's how the organ is scored. So, the higher the KDPI score, that means that the organ is not as good in terms of it's unlikely to have like a long lifespan, in other words. The EPTS score is how the patient is scored in terms of what their expected survival is. So essentially you want a low KDPI and a low EPTS score for a good outcome. And I think this is also important to address because, a large number of these high KDPI organs are actually discarded or unused. And the majority of these organs come from individuals who are older, they're older than 60 years old. So that's part of the issue in terms of like, how do we utilize some of these organs? How can we best utilize it? And in fact, with the initiation of the kidney allocation system in 2014, there was a slight decrease in the number of patients on the kidney transplant waitlist due to these kind of factors and matching the best organs. Okay, let's move on to the next one, the next transplant option. Okay, so the next one is living donation, which can be directed or non-directed. So what that means is a directed donation is you have like a donor recipient pair who know each other, right? So like you have a recipient who seeks out a donor, which may be a friend or a family member. They know each other. A non-directed is what we kind of refer to as an altruistic donor. So somebody who you may not know, but they reach out, they want to donate a kidney to you, and you kind of meet in the process. All right, so the next option, we just go ahead and click forward, is living donation, a paired exchange. Now, this is kind of in the simplest form, just 2 pairs in this paired exchange, but these can go on to 3 or more in this paired exchange. But what this means is if you have a donor and recipient pair who aren't a good match for each other, but there's a subsequent pair who donor may, well, we'll just describe it this way, that donor A might be a better match for recipient B, and donor B might be a better match for recipient A. So it's kind of a paired exchange. So you are all in this paired exchange, but you find the best matched organ, and you can almost like flip-flop. And this is really important too, because, you know, for some of those patients who are, you know, highly sensitized, they have a lot of antibodies, they have a better chance of matching in this paired exchange. And so, you know, what we're trying to do is avoid those chances of, you know, acute rejection or antibody-mediated rejection. And so again, it allows these highly sensitized patients to have a chance at transplant. And also for those patients who may have like an age mismatch or a size of the graft may be, you know, a mismatch, and they can enter this paired exchange and find the appropriate match for them. Next slide, please. Okay, so the next transplant choice is a non-directed donation, which is the transplant chain. Back in 2007, this non-directed or this altruistic donor could initiate these chains for transplant. And what that means is you have a donor, an altruistic donor who doesn't have a pair, they just want to donate a kidney, and they can donate to a recipient. And this pretty much propagates this whole chain of transplant. So a recipient receives that kidney, and then their donor can further donate to another recipient, and so on and so forth. And so the chain ends when you have a recipient who doesn't have, you know, a donor or a pair. Okay, we'll go ahead and click forward then. Okay, and then this is the last transplant choice that we have, which is an advanced or voucher transplant. And this is really good for a chronological incompatibility. And the best way to sort of describe this is by using an example. So let's say we have a recipient who is, you know, has a congenital kidney disease and is likely to need transplant sometime in their lifetime. But, you know, they're at this point, they're young, maybe a teenager, and, you know, but they're expected to need a transplant at some point in their life. We'll just use an example. Maybe dad wants to donate his kidney. And he decides to donate now as opposed to years down the line when his daughter may need a transplant, because at that point he may age out. He may not be eligible for kidney donation at that point. And so he donates a kidney now to somebody who may not even have another donor, may or may not have another donor, but in exchange, his daughter gets a voucher. So when she needs a transplant, she is kind of prioritized through the National Kidney Registry. And so you can actually also name up to 5 other individuals or family members who may, you know, kind of have that voucher as backups should his daughter, you know, get a transplant for any other reason, like on the list, or maybe she doesn't end up needing a transplant in her lifetime. So this is another nice option, you know, in terms of how to approach, you know, improving the number of living donors in the chain, because the more that these high quality organs enter the system is, you know, better outcomes overall. Next slide, please. Okay, so the next slide illustrates this graphically outcomes for individuals with chronic kidney disease. This data is shown from 2002 to 2012. So this is 10 years of data looking at the different modalities from hemodialysis, peritoneal dialysis, deceased donor transplant, and living donor transplant. And I think, you know, it's not much of a mystery here, just to kind of take a look at these statistics, that in 2012, the 5-year survival rates for patients on hemodialysis was only 42.5%. PD may be a little bit better at 50.5%. Deceased donor kidney transplant, the survival increases to 78.7%. And for living donor, 85.3%. So, again, it's important for us to realize, obviously, the survival benefit is incredible looking at this compared to renal replacement therapy. And so whatever we can do to kind of promote more transplant will help with patient survival. Okay, so next we'll look at the cost of dialysis versus transplant. And this graph illustrates the total Medicare ESRD expenditures per person per year. And again, I don't think this is much of a mystery, in terms of looking at the overall cost. We all know that renal replacement therapy, the cost that this has on the healthcare system is quite high. So this is just looking at 2003 to 2017, hemodialysis here at the top, and then followed by peritoneal dialysis, and, very high costs compared with transplant, which is much lower. So, what we're trying to illustrate by the last two graphs is that in the long run, not only is there a survival benefit, but there's also a cost benefit. Okay, and so next we'll look at what does our transplant waiting list look like? So if we can go ahead and click forward here. So this is data according to the OPTN. So that's the Organ Procurement and Transplantation Network. And in fact, this is something that is updated on a monthly basis. So you can, pretty much in real time see, how many patients are on that wait list. So this is as of August 2nd, 2020. The patients on the kidney transplant wait list were 92,477. And in fact, that number is now up to 96,321. So, this just goes to show that, there's a discrepancy and a mismatch, and, supply does not meet demand, right? So, a large number of these patients are still waiting on the wait list. And so let's go ahead and click forward here. Okay, so this shows, right, like over from 1999 to 2019, at the top here, you have the number of patients who are on the wait list, which has just gone up and up and up. So we know that the, demand for kidney transplant has gone up, but again, we just don't have the supply. Now you'll notice this little dip in the wait list around 2014, which that kind of coincides with that, new kidney initiative, the kidney allocation system in 2014. So there was a slight decrease in the number of people on the wait list, but, obviously this wait list still remains high. And the number of transplants steadily has sort of like increased over time, especially in the more recent years, and due to many factors. But also, here, interestingly, at the bottom, if you look at the number of living donors, overall has remained relatively stable, right? So we haven't really done a whole lot to increase the pool of those living donors. And so to that, I'll just kind of illustrate this last point here, which is the next click. So it's only approximately 1 out of 5 people on the kidney transplant list will ever receive an organ. And you can see why, right? So there's, just that supply does not equal demand. And there are many, many patients on the transplant list, and there are still a lot of barriers to kidney transplant and, things that need to be addressed so that we can increase access and improve the use of organs and reduce that discard rate. And now I'll go ahead and turn over to Dr. Jill Green.
Thanks so much, Dr. Kang. So as Dr. Kang mentioned, right, the way the system is set up now, everyone has great intentions, right, of being an organ donor. And the way our system is in the United States healthcare system is that kind of opt-in, right? So you're getting your, you're renewing your license. You're asked if you want to be an organ donor, and you basically click a box, right? Check yes or no if you want to be an organ donor, and then the little sticker is on your license. Which being an organ donor absolutely is a great option. A deceased organ donor can save up to 8 people's lives. during the process. But in the US, approximately only 60% of the population registered to be an organ are registered to be an organ donor. So there's still, a gap that we can fill there. But interestingly, of those 60% that kind of sign up at the BMV and they say they want to be an organ donor, less than 1% are actually are able to donate. And why is that, right? So there's different barriers to the system, right? They, as morbid as it sounds, they have to die in the right way, right? The manner of death. They have to be relatively healthy at the time of death, right? They can't have associated comorbidities that might affect the life of the organ transplant. And then also family consent. So even though you consented that, or you had noted on your license that you want to be an organ donor, there still is the option that a family can decline that consent, after you pass. So again, there's kind of this perfect in a perfect scenario of dying the right way, being a healthy individual, and family consenting, and you have that noted on your driver's license. So again, there's a lot of things that need to line up to have a deceased donor transplant happen. So what's another option? If you can go ahead and next slide. So the other solution, right, that we've kind of alluded to this whole time is living kidney donation. So there might be that thought that, everyone deserves at least one good kidney, right? You only need one kidney to lead a healthy lifestyle. You may know someone that's in need, that's facing end-stage kidney disease. Also, outcomes and the research has shown that if an individual with chronic kidney disease can avoid dialysis and have a preemptive transplant, which is done, which can be done with a living kidney donor, their outcomes are far superior than any individual that has been on dialysis, even if it was for a short period of time and then receives a transplant. So
Excuse me, Jill,
again,
there's a question
yeah,
asking if a person volunteers to donate and gets a voucher for their children who are currently have no health issues. So can a person do that? Are you
can
aware?
a person volunteer to donate? So I might actually punt this. I actually saw Glenna was online, if she was able to answer that. But the whole process is that the voucher system is you donate now and then get that voucher for someone at a later time.
So Glenna did respond and say, yes, they
Yes, they can.
can. She also asked if OSU do they use a high resolution tissue typing eplet matching? I'm not sure if that's you or Dr. King that would
Yeah,
answer
I'm
that.
actually not sure of what type of tissue typing that they do. Specifically, I'd have to find out.
Thank
But
you.
yes, also to kind of reiterate about getting a voucher for you can get a voucher for your children, but also you can get a voucher for family members as well who have no health issues. So you can certainly do that.
Okay, next slide. So if this was the easy answer, I think it wouldn't come without its challenges and everybody would be doing it, right? But there are barriers, right, to living kidney donation. And kind of starting at the top left of that, there are those kind of physical and medical risks associated with the surgery itself, right? So there are, like any surgery, there are surgical risks. However, it's a small percentage. So less than 3% of living kidney donation cases have major complications. And like any surgery, there is a 0.03% surgical risk of death within 90 days of donation. So which is very, standard as far as any type of major surgery and their surgical risk. Kind of as you work your way around, I think oftentimes there may be questions about a potential donor may have questions about their own kidney health. If I give one kidney away, kind of what are my outcomes looking like? Um, and and really the mortality risk, donors live a long and actually even longer life than the general population. So if you think about it though, living kidney donors often are healthy individuals who kind of are in good health and good standing. And when comparing the research studies and the literature reviews, comparing their mortality compared to the general population, um, are much superior. In addition, you think about, well, what's my potential risk of going into kidney failure? If I give one kidney away, what are my risks? So again, when you're comparing to the general population, the risk of eventually developing end-stage kidney disease is much, much lower in living kidney donors than the general population, which makes sense, right? Because these are individuals that are very kidney health conscious. They're giving away one. They can leave a very fulfilling and healthy lifestyle with just one kidney. They're probably very conscious about, their diet and lifestyle modifications that they want to kind of uphold to keep that kidney healthy for a long time. But I will say that compared to healthy non-living donors, there is a very small increased risk of developing end-stage kidney disease with the donor population. But again, very compared to the general population, the risk is much, much lower. As we're working our way around kind of the circle, there are those psychosocial or cultural barriers. So many factors can influence an individual's decision to donate and then really truly give that informed consent that they want to donate. These factors may be their motivation to donate. Whether they know someone, whether it's a family member, and they see the struggle of chronic kidney disease. They also, another factor might be their just knowledge and education regarding the benefits of living kidney donation. Not necessarily for themselves, but then also the recipient as well. And then, a big piece of this is the family or the structure, the social structure and support system that the potential donor has. Whether this is, celebrated or questions are answered along the process, and what kind of support system do you have within your social life to kind of continue on that journey. And then finally, there are some cultural and religious beliefs to keep in mind as well that may be a barrier to living kidney donation. And then finally, clear on the bottom left, there are those kind of socioeconomic or that financial burden and risk associated with donating a kidney. There can be, direct costs associated with being a living kidney donor, or even indirect cost, right? So a lot of times these patients will, or potential donors will have to take off work to do some of the screening steps, in addition to the surgery itself, right? Once they decide to donate, there will be time off work. And they, depending on the financial burden and the financial relief can vary depending on the donor's occupation, their income level, again, back to kind of that social aspect of their support system at home. If they have individuals that can kind of help out with their household as they recover from the surgery. And then also their knowledge of those kind of regional and nationwide financial assistance programs that exist, tapping into those resources as well. Next slide. So what are some strategies to overcome these barriers? I think one of the biggest ones is the Living Donor Protection Act. And this has had quite a history where nationally, it's still in the process of trying to have this national protection across the U.S. But what states have done is kind of taken this very similar legislation and put it into their own kind of state legislator context. So it's noted here in the slide. So this deck was created quite a few years ago, but this Living Donor Protection Act at a national level was reintroduced again back in 2019, and it's had various reiterations. And again, the idea is, can we prohibit denial or coverage or increase the premiums of life and disability insurance for living organ donors, right? So protecting them from that financial burden or that potential risk that they may have, that once they donate a kidney, that they could be denied coverage or have higher premiums, based on this gift that they provided. And then also just kind of establishing protections around time off work through FMLA, and protecting their job, that once they recover from the surgery, they go back and contribute to the workforce. So I just wanted to note that Ohio actually did pass their state version of this bill, House Bill 188. It was signed into law in the spring of 2022, and then it became effective later that July. And again, this has helped and elevated Ohio as a state that is friendly, if you will, and protects the choice for an individual to become a living kidney donor, or a living donor, I should say. It doesn't necessarily have to be kidney, it could be liver. And so the American Kidney Fund, actually, they have this nice kind of report card system where nationwide, the average report card grade for the states is actually a D. And Ohio was always considered C with the protections in place, but after that bill was signed into law, we have bumped up to a grade level B, which is pretty impressive. So we have, again, those protections within the legislation that protects living kidney donors from those financial risks when it comes to life and disability insurance. So at the end of this presentation, I'll go ahead and pop the link into the chat box or the Q&A box. That way you guys can see it. So you guys can kind of all take a look of the various states, where they're at, and kind of what protections Ohio has in place. The second one on the second bullet there is the Advancing American Kidney Health Initiative, or AHI. So again, in 2019, this was an executive order signed by the administration that kind of really focused on how do we better the outcomes of patients with kidney disease. And one aspect of this was to prevent kidney failure whenever possible through better diagnosis, earlier education, earlier awareness. The second one was to increase patient choice and affordable alternatives at kidney failure, encouraging kind of that home dialysis piece, which Dr. Kang had mentioned, right? So there's hemodialysis, but there's kind of two versions of hemodialysis, one in-center and then one at home. And then the third kind of piece of this legislation was to increase access to kidney transplants by modernizing the organ recovery and transplant systems, updating the kind of allocation system and the regulations around it. So again, it definitely takes all pieces, right? It needs the advocacy piece, it needs the healthcare system piece, but it also needs that legislation and regulation piece to really create that positive change. The third bullet point there, how do we overcome these barriers? As simple as it is, but really education and empowerment, right? From diagnosis to transplant, and really that education surrounding what are the options, what are the outcomes associated with those various options. And so there's been programs all across the United States from various advocacy organizations trying to leading the effort in understanding you know, the best outcomes and options for patients. And then down here, when I created this deck, and this was a while ago, back in 2019, I think the idea was sparked, was this kind of idea of a universal living donor registry. And this was a partner, or is a partnership, I should say, between Fresenius and Donate Life America, where they are partnering to create a registry. So if someone's interested in becoming a living kidney donor, kind of where's that first place to start? And obviously, Donate Life America has a fabulous infrastructure already in place, where they are partnering with UNOS and other organizations for kind of that deceased donor piece of the pie. But really now they're stepping up their efforts to understand and better activate living kidney donor, or living donors, I should say, through this registry. And again, this is a partnership with Fresenius and some other partners, LifeLogic, CareDx, NKF, et cetera, where they actually are sponsoring these at-home kits that you can go online. You can say you're interested in becoming a living donor. They send you this kit that kind of takes that first step of the screening process, and you can send in those results and start the process of becoming matched. And the pilot was, the pilot was completed in October of 2021. So then the official registry now is up and going. Started in December 2021, and the first transplant from this universal national or universal living donor registry was completed in July of 2022. So it's really cool to see. You know, I created this content and this presentation many years ago in collaboration with Kidney Donor Conversations, and Glenna, I know you're on the line. This was just an idea when we were creating this deck, and it's really amazing to see the progress and the positive change that has happened over the years, and the outcomes of it, right? That a successful transplant, someone was an altruistic donor, they were able to donate and you know, provide that gift of life to someone. Next slide.
Jill, there's a question. It's
Yeah.
asking about if a person volunteers to donate a kidney today to anyone they don't know, who pays for the workup and donation surgery? And then there was a question too about the donor's health insurance. They are asking if it was mentioned, does their health insurance increase after donation? Are you aware of that?
So the first question is, so that is all, none of that is on the donor. None of the workup is on the donor itself. It's all eventually, I guess, well, and they had asked about an unrelated recipient. Dr. King, are you aware? So I know that when you're going through the process, a lot of the information actually, or the cost associated, gets end up billing through the recipients.
Right.
Insurance.
So I'm not really sure about, you know, an unrelated or somebody they don't know.
Yeah.
Not sure how that gets billed.
We can follow up, and we can get back to you on that. And then
Okay.
I'm sorry, Jennifer, what was the other question?
So the other part of the question was, they were asking did you say that the donor's health insurance increases after donation? So is there any I guess backlash to a donor as far as their insurance is concerned?
So it would be on an individual case, but that is the point of this Living Donor Protection Act that was signed into law in Ohio in 2022. So it's going to prohibit any health plans from increasing that health insurance and increasing the premiums after you donate. But theoretically, prior to this legislation in place, health plans could, if they you know, felt that those risks were higher now.
It looks like Glenna answered that it is billed through the recipient's insurance after donation, and that's in regards to a living donor, all of their costs associated with that. But as far as, any other health issues that come up, I think it then falls back on the
Yep.
living donors insurance.
Okay, next slide. So just some next steps. We put this in here for you to take back to your community, to your patient, kind of thinking about if individuals are interested in becoming a living kidney donor, kind of what are some next steps. So again, obviously, raising awareness and advocating for the opt-in organ donation registry that we have through, our local motor vehicle department. So signing up online, and also striking those conversations with family members about your wishes, that you want to be an organ donor. The other one is a program nationally through the NKF. So they have this Big Ask, Big Give initiative. And these are different programmings within the community that if you're interested in either donating or receiving, if you're looking for a kidney, you can go there and kind of understand the process, understand the ins and outs of the donation process, hear testimonies, resources on how to ask individuals that you're in need of a kidney transplant. So it's a really great initiative, and I'll just share real quickly that one of the maybe silver linings of the pandemic is that a lot of these programs started to become available virtually. So you didn't have to go anywhere. You could kind of be there from the comfort of your own home and kind of learn about the process if you just had that little bit of the interest of the process and what it might be like. And I attended one of these during, let's see, it was like mid 2020 when I was kind of thinking about this process. The next one is contacting the potential recipients transplant center. So oftentimes there's this health questionnaire of kind of why you're interested. Is there someone in mind that you would like to donate to, or if you're just donating altruistically, kind of what are your motivations, etc. Kind of just a basic health questionnaire to see, are you appropriate to move on to the next step of screening. A lot of transplant centers have moved these health questionnaires online, so you just kind of go to a transplant center's website and easily fill out, the health questionnaire, and then you'll be contacted, for next steps. Living Kidney Donor Registry. So we kind of touched on the universal one that's in place, but there's also the National Kidney Registry, or NKR. There's other ones, Alliance for Paired Kidney Donation, looking again for those kind of paired donation swaps, if you will. And then UNOS as well, the United Network of Organ Sharing for the kidney paired donation. And then obviously I wanted to give a huge shout out to a nonprofit that we work closely with, Kidney Donor Conversations. And I know Glenna's on the line as she's answered. She's a true expert in this space. Just starting the conversations. How do you, if you have this interest in becoming a living kidney donor, what are kind of the next steps to become activated? Okay, next slide. So the last 10 minutes left here. This is actually from the Kidney Donor Conversations website, and it really just kind of highlights the different stages of becoming a living donor. So at first, the idea is sparked. Then you have a time of quiet thinking, maybe active exploring, looking at the various websites, different resources. You start the workup. So you show that you're interested, you fill out the health questionnaire. You might move on to the next step, which is more, you do a buccal swab and start to see different factors that may play into how you're matched with your potential recipient or donating altruistically. Then you'll have this full workup, which is an all day, at least at Ohio State, was an all day thing, which again, they're taking, samples of blood and tissue typing and making sure that kind of that match process is solidified prior to the surgery itself. And then you'll have recovery and then future life. And this different stages. It's going to be different for every donor. So for me personally, I have always been surrounded by kidney disease, unfortunately. So a genetic kidney disease, polycystic kidney disease, actually runs in my family. And when I was 10 years old, my mom got really sick and went on dialysis. She was on dialysis for a few years, and you know, luckily was matched very well with a deceased donor kidney, which lasted 18 years, which was a beautiful gift of life. It truly gave my mom back, as I say. And I was able to grow up and, have my mom around and be present at all of these big life events back then in high school and then throughout college and then, my adult life. And um, at that time, so it lasted the kidney lasted 18 years. Um, she ended up going back on dialysis, which was difficult. We all know how hard dialysis can be. And excuse me. And she went back on dialysis, had multiple struggled with getting back on the deceased donor list. Excuse me. And dialysis is never an easy road. But I think in her mind, she thought, well, I'll just do what I did last time, right? Put in my time and then hopefully get matched to another deceased donor. At the time, I was going through, well, do I have polycystic kidney disease? If I don't, what does that mean? What do I do with this gift? And long story short, I did not inherit the disease. So I kind of had the conversation that either I'm going to donate to you, to my mom, or I'm going to donate to a stranger, because I'm going to do something with this gift that I didn't inherit this kidney disease. So the idea was sparked. Quiet thinking took, I always joke that I actually printed off the health questionnaire and it sat on my printer for like a good 6 months, just kind of staring at me, right? I knew I wanted to do it, but it was really, that was going to be the first big step in this process. So got it sent in to my recipient's transplant center, which was Ohio State, which partially, I motivated her to have the transplant done there because I live in Columbus, Ohio. So then was contacted by Ohio State's Transplant Center and kind of started that process, as I said. So understanding your motivations for donation, I'm sure many transplant centers are the same way, but they really make sure that you're not pressured into the decision and that it is yours alone and it's truly informed consent. And so I went, I did the buccal swab, we did tissue typing, we did the full workup. And that part for me was very fast. That now we're talking about you're a match, we're good to go. What day do you want to do the surgery? So we had the surgery. We had the surgery in November of 2020. And successful surgery. I was home. See, the surgery was a Friday. I was like discharged from the hospital by Sunday morning. It's really surprising that you go through this major surgery, and again, this is my personal experience. It's not going to be the same for everyone, but they have you up and walking, ready to go. And oftentimes, living kidney donors, if they know the recipient, they actually always joke that the recipient is feeling better than even the donor themselves, right? Because in my instance, my recipient, my mom, was on dialysis, and they get this gift of life, and they feel so much better immediately, right? So we're taking walks, down the hall, slowly, of course. But she was just discharged the day after I was. Um, and we were able to recover nicely here at my home. The recovery looks different for everyone, right? Again, another silver lining of the pandemic was that it was in late 2020. So we just kind of chilled and watched Netflix and while during our recovery time. For me personally, I didn't take very much time off work, but everything was remote at the time anyways. Um, so I think it was a total of 2 weeks. And then I was able to kind of hop on and do some year-end stuff for work. But again, it was all virtual. So again, everyone's experience will be different. But I always joke that my recovery, it was an abdominal surgery. So I actually have 2 beautiful kids born via C-section. And it was an abdominal surgery, like a C-section, right? But instead of taking care of a newborn, I just got to chill and watch Netflix on the couch. So again, I think many times kidney donors or living donors will say if they could do it again, they would. And I know that that's personally true for myself. It was a great experience, but I only have one kidney left. So, but it's a great experience to know that you're providing that gift of life to someone. So with that, I see we have 2 minutes left. Jennifer, are there any other questions?
I don't see any other questions in the question and answer box. If you do have a question, if you can put it in the box, and Dr. Green or Dr. King can answer those. In the chat, we put our website for our Journey to Transplant booklet and videos that go along with the booklet. This is something that we put together, kind of helping patients understand the transplant process from beginning to end, what that looks like. So I encourage those of you that are working in dialysis centers, please feel free to take a look, view the videos. There's a lot of patient testimony about the process. And Kidney Foundation of Ohio can make available some of the print material that goes along with that, if that's something that your facility can utilize. We have an anonymous attendee that said they are a living kidney recipient. And Jill, you are an organ donor hero. So thank you for sharing your story about your organ donation and just the process. And hopefully there's more people out there that would, consider and kind of do that quiet thinking and active exploring about being a living donor. And again, we have another person that had shared, thank you for presenting your kidney donation, and would love to see more donors. So we are coming up on our time, and I thank all of you for participating in today's webinar. At the conclusion of this webinar, you will get a link to our survey, our evaluation. We ask that you complete the evaluation. Once the evaluation is complete and compiled, we will then be sending out CEU certificates. And if there's no further questions, we thank you all for being part of the Kidney Foundation of Ohio Learning Series on living kidney donation, and look forward to seeing all of you at other webinars that will be coming up, and then of course at the Renal Symposium in September. Thank you all, and enjoy the rest of your day.
Thank you all.
Thank you.